Blackbird singing in the dead of night. Take these broken wings and learn to fly. All your life, you were only waiting for this moment to arrive. Blackbird singing in the dead of night. Take these sunken eyes and learn to see all your life.
The current climate, it's a lot better than it used to be, in my opinion. I've been mostly a lifelong Duluth resident, and I've seen it go from a lot of fear because of not knowing what's going on. And I think Duluth has gotten a lot better about addressing their own issues with it, and I think Duluth is a lot more accepting of it now and offering more services to the transgender community.
It's kind of happening maybe a little bit, but if you really, really want to make sure you have nice weather or healthcare, you need to get out of Duluth. And that, for many people, means a trip to the Twin Cities, or for some people it means trips to either coast of the United States. So yeah, there's good stuff beginning in Duluth in terms of trans healthcare, but I wouldn't say that it's consistently available, especially for people who do not have insurance. So it's not totally dismal. It's better than it used to be. It's getting better. And it's getting better, I think, if we really were able to track it. Saying month by month getting better might be a little too generous, but I think year by year, if we were to track practitioners who are offering healthcare to trans people, there's something being added, on a yearly basis at least to this community.
I'd say there isn't really an acknowledgement of the need for it. I know there are some clinics that are trying to provide hormones and things, but as far as surgery, there's very limited access.
I think it's getting a lot better. I am a native of Duluth, and I'm 27, and I've had gender identity issues for much of my life, and I feel like when I was a teenager, everybody wanted to kind of say, well, it's not this, it's maybe this with your family, or that, and I felt like nobody listened to me, and I feel as transgender issues gained awareness on a national level, that people in Duluth kind of started to wake up and see, oh, there could be some of these individuals right here in my backyard.
There isn't a lot up here, but if you're kind of in the community, working, like people here and there, but it's definitely, it could be better.
The current climate, I think, from what I've experienced, has been fairly welcoming. My experiences, mainly like at my doctor's office and therapist, have been good. Kind of the same things with all the medical forms. Most places don't have that gender identity section. So with my therapist, I wrote in at the top of the form, what my preferred name was, pronouns, and even made a point to go to the receptionist to say, this is what I want to be called when someone comes to get me in the waiting room. But the therapist I've seen was really accepting and worked to educate herself on the trans community and trans healthcare, and kind of worked with me for what my needs were, so that was really good. I'm currently switching therapists right now, so I did an intake at a different clinic in town here, and they were super awesome about using my preferred name and pronouns, and they're trying to fit me with someone who's familiar with the LGBT community, which is awesome. So overall, it's been a good climate for me. But I think there's always work to be done. Things can be updated and things can definitely get a lot better.
I think it's really unfortunate that in Duluth we still have to go with the old model, which is see a therapist, get your letter. I think that an informed consent model in Duluth would be greatly beneficial because a lot of people have to spend so much time and effort just to get their letter, and there's so much more beyond that. And nobody knows you better than you know yourself. Nobody has to live with your choices but yourself, so I think you should be able to choose to be happy.
Access. I know a lot of the private plans that are accessible through MNsure don't have any services related to surgery, and the public plans actually specifically exclude it, saying that they won't help people get surgery. So that much as far as health insurance I know. I know that the doctors that I have been to in Duluth don't ask about gender identity or anything like that, so it makes it difficult for people to come out and difficult for people to transition openly with their doctor.
I think just the education level of most healthcare practitioners, I don't think it's at the forefront of the majority of their minds. I think with recent media issues, I think it's definitely becoming more of something that practitioners know about, at least. But I definitely think that there's a lot of work that can be done on, clinics and doctors and therapists and all of that, being aware of the trans community and being open and accepting to learning more about that.
Barriers, things like top surgery, testosterone, those should all really be covered under insurance, in my opinion, and I don't think they are currently.
And I refer people to resources to try to connect to healthcare insurance and to different healthcare resources in the Duluth area. So that relates to trans healthcare and the fact that a lot of public programs don't cover trans services, so we try to find alternative clinics and things that will do that for them.
That it makes me so happy that people are able to start transitioning without having to run down to the cities all the time to get a prescription. We have doctors in Duluth that I'm told do provide the testosterone prescription, and they also get to transition at home where they feel safe, and I think that's more valuable than anything.
I work at a nonprofit, and that whole climate or community, I guess, of nonprofits has been super awesome with my transition. Everyone is very supportive. So that section of Duluth, all these different nonprofits, I think are more aware of the trans community and definitely work with people and don't make you feel like a weird part of the community, so that's been really cool.
I'm seeing a lot more therapists being open to people coming to them and saying, I'm having a problem, and therapists being willing to educate themselves, and I'm seeing a lot less of trans people having to educate their own provider, which is a small step, but it is a step in the right direction.
What I would really like to see with transgendered healthcare in Duluth is a more prominent presence. Actually advertising and saying, transgendered people should come here for the help that they need and things along those lines, because I think it's kind of a secret society right now. It's kind of a word of mouth thing, and I want to see it more in the mainstream.
Learn to fly all your life. You were only waiting for this moment to arrive. Blackbird singing in the dead of night. Take these sunken eyes and learn to see all your life. You were only waiting for this moment to be free. Blackbird fly. Blackbird singing in the dead of night. Take these broken wings and learn to fly all your life. You were only waiting for this moment to arrive. Blackbird fly, blackbird